Welcome to our 5 on 5. We're talking about the 2019 Southern Oregon LGBTQ Plus Health and Wellness Summit with the event co-chairs, Dr. Kelley Burnett, the lead medical director at AllCare Health. Thank you for being here.
Yeah, thank you.
As well as Liz James, the former CEO of Lesbian Health Initiative in Houston, Texas, and a volunteer leader with the AARP Southern Oregon Community Action Team, as well as a member of the Oregon Statewide LGBTQ Again Coalition. Thanks for being here, Liz.
Thank you.
So let me start with you, Liz, in case anyone doesn't know. What is LGBTQ plus?
Yeah, I'm really happy you've asked that question. A lot of times, many of us just reel off those letters and assume people know, and they don't. So let me start with the first one. L stands for lesbian. B stands for bisexual. T stands for transgender. G stands for gay. And then we've got Q in the letter, and Q can be queer or questioning, and then we add plus. And the reason why we add plus is there are a number of other designations that people use to identify who they are. One is I, for example, that means intersex. A can be asexual or an ally to the community, and quite frankly, there's some other letters as well. So I think it's important that people know, A, that's not one community, that's a real broad range of people in the community that have different issues, and we're, different ethnicities and, different layers of education. So we're quite diverse.
Yeah, okay. And so, Dr. Burnett, what about the summit? What is this exactly?
The summit is a two-day educational conference that will be held May 9th and 10th at the Jackson County Health and Human Services building on Holly Street. Mm-hmm. And it's geared towards primarily the medical and behavioral health community to educate providers so that they can provide culturally appropriate and inclusive care, although it is available to the community at large. Day one will be an overview of a broad number of topics that impact the LGBTQ plus community. Day two, because of the need in the area, is a deeper dive into transgender health issues specifically, and the OHSU Transgender Health Center will be coming down to provide trainings both for medical providers and behavioral health providers to increase the repertoire of what care can be provided locally rather than having all of these patients need to go to Portland or other areas for treatment.
Mm-hmm. Okay, and you mentioned it's May 9th and 10th. It's a two-day conference. Is there a fee associated with attending this?
Yeah, the fee varies. It can range. There's 1 day or 2 days. Really, day one is a prerequisite to day two. For 2 days, it can be from $50 to $80 for early bird registration, which is until April 1st. The price goes up 10 days, or $10, excuse me.
Sure.
After that, we're trying to keep costs low so that people can participate, and basically just to cover our own costs for putting them.
Okay, and people can sign up on the website?
Yes.
Okay, all right, we're going to take a quick commercial break. Much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with the co-chairs of the 2019 Southern Oregon LGBTQ Plus Health and Wellness Summit coming up in May. It looks like Thursday and Friday, May 9th and 10th. Kelley, so people can also further their education by coming to this.
Right. We are offering free continuing education credits for both doctors and behavioral health providers. So that's another great reason to come to the conference.
Yeah, and it's designed for medical professionals,
yes,
as you ladies talked about before. So, why is this needed, Liz?
Well, I think people are like, why is it different from the everyday heterosexual person? Well, the reality is LGBTQ plus folks do have the same health issues, but they face higher risks for certain health issues, including different cancers, different behavioral health issues. In addition to that, there's some challenges they face when they actually go to get care in terms of the level of knowledge of providers. And I think Kelley's really suited to kind of talk a little bit more about that.
Right. Well, working from the CCO and when I was in private practice, there's just can be a lot of stigma associated with being in the LGBTQ plus community. And when we've surveyed, we've found that a large number of patients have had negative experiences either with providers themselves or with the staff, just by not using the right language or making assumptions about what care is needed, to the point where people are traveling out of the area. I mean, people are regularly traveling to Eugene and Portland or other areas to get the care we need. So we really want to help provide the education so that practices can have those inclusive practices, and provide a service for patients here.
Okay, yeah.
Well, and research shows that healthcare providers are really interested in learning more, so that they became providers because they want to take care of patients.
Yeah.
And they want to be properly equipped to do that. And our goal is to provide a level of knowledge and education plus a lot of resources to help really increase the capacity in our part of the state.
Yeah, okay, excellent. And so people can get more information, including tickets, if you will, on SOLGBTQHealthSummit.org.
Yes. Yes.
Absolutely.
Thank you
We
both
hope
so
to
much
see
for
you
being
there.
here.
Thank you very much.
All right, stay with us. We'll be right back.